This young man has hemophilia. Hemophilia is a genetic disease in which the clotting of your blood is irregular. This irregularity can cause you to bleed internally and externally profusely after injury.
Hemophilia is listed as a rare disease. Only 0.01% of people in the United States are diagnosed with it. Hemophilia is carried through the X chromosome. There is a high chance for males to get hemophilia because it is impossible for males to be carriers.
Females have a chance at being only carriers of this disease, for they have 2 X chromosomes and males only have 1.
In very rare cases, hemophilia can be contracted without running in the family. If you have this type of acquired hemophilia, your antibodies attack your clotting factors, causing them not to function correctly. This trait is recessive. Since it is carried through the X chromosome, males don't have another X chromosome to dominate it. If a woman is a carrier and a man does not have the disease, their combinations can result in having a normal son, a normal daughter, a carrier daughter, or a hemophiliac son.
Everyone who has hemophilic parents or carriers of hemophilia are at risk, especially males.
Well, I heard the easiest way to get tested was to compare my DNA with that of a hemophiliac. So I went into the doctor's office and they drew my blood. Within a week, I found out that I was a hemophiliac. Since this disease is so rare, I never thought I'd actually have it.
So what made you want to get tested?
I had minor surgery when I was 12 and nearly bled to death. I also had frequent unprovoked nosebleeds throughout my life. After I was diagnosed, I noticed other symptoms like constant headaches, sudden weakness, and clumsiness.
Has your life changed much since you've been diagnosed?
It has changed somewhat. I especially have to be careful when I go white river rafting with my friends and dad. I use clotting factor replacement and desmopressin on a regular basis before rafting. It has changed my life, but because of regular treatment, I'm able to live normally.
The genetics for hemophilia have been identified as mutations in the F8 and F9 genes. F8 being hemophilia A and F9 being B. The F8 gene, located in the X chromosome, is responsible for making a protein called coagulation factor 8, which is essential for the formation of blood clots. Similar to F8, F9 is also responsible for blood clot formation, restraining profuse bleeding after injury by sealing off damaged blood cells, but is located chiefly in the liver. Okay. The disadvantages of replacement therapy are the development of antibodies that act against the clotting factor. Viral infections and damage to muscles and joints when treatment is missed are also symptoms. Hemophilia isn't completely curable, but is manageable when the right treatment is used. Gene therapy at this time is not available for hemophilia patients. Researchers are trying to find a way to correct the faulty genes, but no acceptable treatment has been created yet. Okay.
If you are seen to be bleeding profusely, first, your doctor will check your family history to see if anyone in your family has had hemophilia.
Symptoms like excessive bleeding are caused by the F8 gene not forming blood clots to seal off damaged blood cells, and therefore injuries continue to bleed.
So, the time that symptoms can occur can be different for every hemophiliac. Some of the symptoms at infancy, which include a deep bruise after a routine vitamin K shot, continues bleeding after circumcision, and in a rare case, profuse bleeding after an umbilical cord is cut. You may not experience symptoms until you are older.
Hemophilia is a chronic disease, and in some cases can be lethal. Because of the irregular bleeding, hemophiliacs can bleed to death internally or externally after minor or major injury.
Without proper treatment, hemophiliacs can die before childhood is reached. Though with proper treatment, hemophiliacs can expect to live a normal life expectancy. The life expectancy of males with hemophilia are about 10 years under the expectancy of normal males.
If you are feeling any of these symptoms or your doctor has diagnosed you as a hemophiliac and want to learn more, you can go to the National Hemophilia Foundation, or you can read Official Patient Sourcebook on Hemophilia by James N. Parker.